Before we start taking any medication, here are 5 very important things you need to know. But before I dive into that, I would just like to put a quote by Paracelsus out there that says, all drugs are poison. It is the dose that determines its therapeutic or toxic effect. Yes, every single medication out there is poisonous, and what actually determines if it's going to be therapeutic, help you treat your sickness or disease, or if it's going to be harmful to you, be toxic to your health, is the dose. So how are you taking your medication? Why are you even taking this medication? These are some of the points we'll be dealing with today. And the first on this list is the purpose of the medication. Yes, knowing why you're taking a medication is just as important as taking it. This would help you take it more safely and more effectively. It'll help prevent you mistaking a blood thinner with a pain reliever. I mean, if you know if the drug is supposed to treat pain, if it's an antibiotic that's supposed to help you treat an infection, or if it's a medication that's supposed to help you control or manage your health state. And also, it'll help you avoid any form of misuse. You won't, share your prescription with someone else. These are all very important. So if a doctor writes a prescription for you, you have to ask questions. It is your right to do this. Let the doctor take his or her time to explain a few things for you, tell you why the medication is being prescribed, especially if it's more than one on the prescription. You can't just receive a prescription from a doctor and bounce. That is wrong. Inquire. This is something that's going into your body and you have to take it very seriously. Let the doctor tell you, okay, this is meant to treat this pain you complained about, or this one is supposed to help you with that hair loss, or this one is supposed to help you so you don't pick up an infection based on this and that. This is something you need to be aware of. And even when a pharmacist is filling up the prescription for you, you still need to ask a few more questions. Okay, so is this the medication that was meant for the pain? Or I complained about some itchiness. Is this the one for that itchiness? It'll also empower you. You'd be able to track, the progress of your medication and reports back to the doctor that prescribed it. Number 2 is dosage and timing. You always have to take your medication the way it was prescribed. Dose it the way it was explained to you. Do not try to rearrange anything to fit into your own plans. This is why you had to ask those initial questions so you know what you're doing. How much and how often am I supposed to take this medication? Am I supposed to take 1 tablet, 2 tablets, 3 or 4 tablets, once, twice, or 3 times in a day? Is it okay if I take it in the morning? Is it okay if I dose it at night? How am I supposed to go about this? Especially if you have so many medications to take in a day. You need to know how you're supposed to fit them in and how much you're actually supposed to consume in a day. Because certain medications can cause drowsiness. So you're not supposed to take them during the day when you're still active or operating machineries like cars. You can become a potential threat on the road for other drivers, and that is not good. Please know the timing for your medication and know when you're supposed to fit them in to avoid all these complications. This one is for the chewers. Those people that chew their medication. Some of them don't even remember to drink water after chewing it. I'll say this, please take note. Not all drugs are meant to be chewed. I'll repeat that. Not every medication should be chewed. Please, some drugs can actually irritate the stomach lining. So they are being coated so they can be broken down after they have passed the stomach. So imagine you just take that drug and you just start chewing it from the beginning. And some of you don't even remember to drink water to help flush it down. And now you're just exposing your stomach to the effects of that drug. This is why some people get stomach ulcers. This is why some people feel so much discomfort that should have just been avoided if you had just taken it the right way. Aspirin and diclofenac are some examples of medications that are mainly coated. I know some people love to pop this one at any slight discomfort. That headache you're feeling might just be out of stress. Maybe you just need to take a nap. Maybe you just need to rest, and when you're awake, you're going to feel so much better. But even if you do have to take this drug, always look out for that EN, and once you cite it on the box, chewers, avoid it because it stands for enteric coated. Take it the right way with a glass of water and allow it to work the way it's meant to work. And number 3 is possible side effects. You need to know common side effects that could occur after taking certain medications like dizziness, drowsiness, nausea, or headaches. You also need to know when to seek medical attention if you are experiencing serious side effects like allergic reaction or breathing difficulties. Please, these are all important questions you need to find out, or you check the leaflet in the drug pack to be able to learn all of these things so that you are fully aware of what you're putting into your body. Number 4 is interactions and contra. This is simply checking if the medication you're being prescribed is compatible with the one you're already taking. Is it okay with my supplements? Is it okay with the meals I'm eating? Because there are certain meals that can interact with your drug and not allow it to work the way it's supposed to work in your body. Example is grapefruit. Please avoid it when you're taking medication because it has tendencies of interacting with a lot of drugs. Also taking notes that some drugs can interact with each other, therefore reducing the effect of one drug or making the effect of the other to become too much in your body, and that is not good. Always confirm if you have any health condition that could make some drugs unsafe for you. Are you pregnant? Do you have a liver disease? Because many drugs are being removed from the body via the liver. So if your liver is not functioning the way it should, it would lead to accumulation of some drugs in your body, thereby posing some serious toxicity to your system. And if you're pregnant, please ensure to always mention to any physician you're meeting that you are, so they can take this into account and prescribe drugs that are safer for you to avoid birth defects, stillbirths, or even miscarriages. Please, this is very important. And number 5 is storage and expiration. I know people love to underrate this one. They don't think it's important, but it's very important as well. If your medication is meant to be stored under room temperature, make sure you keep it there. If it's meant to be stored in the fridge, even if you don't have light, try and get some ice packs and contain your medication under that temperature. And take note, do not take any drug that has expired. It could lose its effectiveness and also become very harmful for you. And a bonus tip, if you missed any dose of your medication, do not take double to try and compensate for the one you missed. Maybe you missed the one you were supposed to take in the morning, so you're wondering if you should take double in the afternoon to compensate for that one. No, do not do that. That is wrong. Just continue the one you're taking in the afternoon as you should and keep it moving to avoid overdose. And if you actually overdose on any medication, do well to call for help immediately so you can be attended to. Call your physician so they tell you what to do, or you take yourself to the nearest hospital so they can attend to you carefully. And that's all we'll be talking about today. Please always ensure to consult your doctor or pharmacist if you're unsure, and please do not share your prescription medication with others. Thank you so much for tuning in. Please do well to like, share, subscribe, and turn on that notification bell so you would be the first to be notified when I drop the next video or I come on live with a health colleague to share useful health tips that could be beneficial for you or someone near you. Until then, please lead a healthy life.
Thank you for the love that you give. Thank you for the way that you live. You light up my world. You make it all worthwhile. Thank you for the way you make me smile.